Hi, good afternoon. I'm Dr. Vidya Suratkal from Lilavati Hospital from the cardiology department. I have done my DM in cardiology and have an FACC also in cardiology. I basically run the non-invasive cardiology department and I'm interested in clinical cardiology. So today we are going to discuss about heart disease in women. Now, it's a common misconception that it is thought that heart disease is a man's problem. However, several studies have revealed that women are at significant risk for heart disease. Now, heart disease means there are 4 or 5 types of problems that could occur. One is blockages of arteries, which can cause heart attacks. Second is electrical problems, which could cause arrhythmias. Third is muscle problems, which could reduce the pumping of the heart, and valve problems, which can cause leakage, tightening. Today we will discuss blockages causing heart attacks. Each topic is a large one by itself, especially in women. Now, in India, we have found that 25% of the deaths are in both men and women are due to heart disease. Several studies like the Global Burden Study has shown that the highest amount of mortality in women is because of coronary artery disease or blockages and heart attacks, along with other problems of the heart. This is much more than the deaths due to breast cancer and other cancers together. In the last 2 decades, there has been almost a 300% rise in mortality in women due to heart disease. Now, why is this happening? The challenge in addressing this problem is basically because of the lack of awareness, lack of knowledge amongst both the public and the medical practitioners about heart disease in women, about heart attacks in women, about what symptoms they present with, and therefore there is an under-treatment, under-diagnosis and poorer outcomes. In addition, there are a lot of societal norms, a lot of cultural beliefs which women believe in and therefore seek medical help much later than they should, resulting in increased burden due to underdiagnosis and under-treatment. Many of the women are caregivers and take care of the family and are responsible for them. Hence, they hesitate and neglect themselves in going in time to hospital. Also, the family is hesitant to spend much money on the woman of the house and would rather spend the same amount of money for investigation treatment on the men of the house. Similarly, medical practitioners may not be fully aware of the kind of symptoms women present. In India, we have found that it is at the age of 59 years that women present with heart attacks, which is a very young age compared to the Western counterparts. And all this is because of delayed diagnosis, delayed investigations, and inadequate treatment given to the women of India. This also includes the rural women. Now, I would like to tell you all what the basic differences are regarding heart disease between men and women, especially for blockages and heart attacks. First of all, the heart of the woman is different from that of a man. The size of the heart is smaller, the arteries are smaller in size, and thirdly, the muscles are weaker. Secondly, it is microvascular heart disease that happens. That means it is not the big vessels of the heart that are always involved. In women, it is the small vessels of the heart that are more commonly involved. And lastly, it is the hormones which make a very big difference. As long as the woman is premenopausal, it is the estrogens that protect her. Now, estrogens make the arteries very flexible, 1, and 2, keep the lipids under control. Now, the men don't have this protection. However, post-menopausal, the hormones are lost and then the woman is at very high risk, or if she attains early menopause. Now, what are the risk factors little different from men for women, which we should recognize. One, anemia. Anemia turns out to be a very major risk factor in women. Endometriosis, which a large percentage of women suffer. Third, problems in pregnancy. What is it? Like blood pressure, diabetes during pregnancy in young age can result in heart attacks and blockages at an older age. Hormones, which I already told you, especially if they have early menopause, they take oral contraceptives or postmenopausal hormones. Then autoimmune disease, which is very common in women, much more common in women and not so much in men. It is the inflammatory form of these autoimmune disease like rheumatoid arthritis, systemic lupus erythematosus, which increase the risk factor in women for getting blockages. Then obesity, lack of exercise, mental health problems and metabolic syndrome. These are very common in women and these increase the risk factors. Now there are certain risk factors common to both men and women, but they affect women much more in producing blockages. Like for example, diabetes, smoking, poor HDL, that is the good cholesterol, and blood pressure. All these are common to both, but when a woman has all these, it is much more deleterious than for a male. What are the presentations of heart attacks or angina in a woman having blockages? It is very different from that of a male, and probably that's why it is not very commonly recognized initially and there's a delay in diagnosis. In men, they get chest pain, heaviness, discomfort, uneasiness during exercise, physical exertion, walking, swimming, running, and this disappears at rest. While for a woman, the pain may come on at rest. The most common presenting symptom for a woman suffering from coronary artery disease is tiredness, extreme fatigue. The woman usually comes 2-3 times to the OPD before she develops a full-fledged heart attack, saying that I'm extremely tired and I cannot explain why. This is the most common symptom. They also complain of sleep patterns being disturbed, tiredness, breathlessness, giddiness, nausea, vomiting. If they have pain at rest or during their routine activities. However, some women do have symptoms similar to men. Many of them have pain which gets triggered by mental stress. So these are the main differences in the presentation, diagnosis and causes of heart attacks between men and women. So what is our aim? What is my message to you all today? My message is that every woman should not allow herself to get neglected or should not neglect symptoms because they are different from that of a male, because she is a homemaker or because there are some financial problems. She must present herself to the medical practitioner with whatever symptoms she has, especially if she has risk factors. Of course, try and correct your risk factors like stopping smoking, diabetes, blood pressure, etc. Please don't neglect yourself. As one would say, if you are responsible for your family, be responsible to your heart. Thank you.